Ahmed, Acting Medical Officer of Health, and Nicole Dupuy, Director of Health Promotion for the Windsor-Essex County Health Unit. Good evening.
Thank you, Mr. Mayor, and the respected council members. My name is Dr. Wajid Ahmed, and I'm the Acting Medical Officer of Health for Windsor-Essex County Health Unit. I'm also an adjunct professor at the University of Western Ontario, and I also support public health and preventive medicine specialty at the Royal College of Physicians and Surgeons of Canada. As a physician, I specialize in public health and preventive medicine, and I have the credentials to make recommendations that promotes and protects the health of the protect the health of the community. As the agency, we have a legislative responsibility to protect and promote the health of the community. We recently conducted the oral health assessment of our community, and let me tell you, the results are not good. We looked at various factors that impact oral health, and when we were asked the adults and seniors in our community how they dealt with their oral health problems, this is what we have heard, and that slide is not showing up. Number 2. Okay. So our residents have many unmet dental services, and the community is dealing with them in many different ways. And I was supposed to show the slides, which was not there, so I apologize for that. But we have to recognize that there are all these unmet dental services that are needed in the community, and we need to take action, and this is concerning. When we are looking at the average number of cavities per child in Windsor and Essex, when we did our oral health assessment, the health unit staff looked at the mouth of every child attending public and private school. This was not a sample. It was a complete comprehensive sample of every child in Windsor and Essex County. The data collected from that oral health assessment shows that the average number of cavities per child in Windsor and Essex County is steadily climbing up. To put things into context, by the age of 7, every child in our community has an average of more than 2.5 cavities. So imagine every 7-year-old in your community who has an average of more than 2.5 cavities in their mouth. This should be alarming for our community. The trend is consistent in all grades, and it also increases as the children grow older. As children grow with poor access to preventive dental services, when with poor over health, they grow older and have many health challenges and will likely develop oral health related complications that will result in ER visits, day surgeries, and when we are looking at the current number of these data from adults visiting ER in Windsor and Essex County, we can clearly see that the rate of ED visits in Windsor and Essex, represented by the red line up there, is much higher than the comparable communities of Hamilton, Niagara, Middlesex, London. So how do we go and fix it? There is no single strategy that will change it. We need many different strategies combined together. We as a community need to take the responsibility of this problem and act in the best interest of the community, and not based on my personal opinion on this issue. Interventions that improves overall oral health has different levels of impact, and the solution should yield maximum benefit for the entire community. If we want to improve the oral health of our community, we need to work on the individual level factors and increase the knowledge and behavior of our community. For example, telling individuals to brush their teeth. The downside of this approach is it has a low impact and it is not cheap. The other intervention that you can do is improving healthcare system, which is shown to increase access in oral health services in the community. This has a medium level impact, and it is very expensive. And then we have community level intervention, such as implementing policies that helps to remove the socioeconomic barriers. For example, adding fluoride in the community drinking water system, which protects everyone, rich or poor, old and young, equally. And the upside of these type of intervention, it has a very high impact and has a very low cost. There are a lot of misinformation regarding the benefit and safety of the community water fluoridation. I'm missing many of the slides here. There are a lot of misinformation regarding the benefit and safety of the community water fluoridation, and what I'm presenting today to you does not reflect the view of Dr. Wajid Ahmed, but it also reflects the whole scientific community. Community water fluoridation is supported by more than 90 agencies worldwide, and the effectiveness to prevent dental cavities established through decades of research. And as you listen to all the delegates presenting in front of you, please note that our recommendations are for the benefit of the entire community without any personal bias. When it comes to community water fluoridation support in Windsor and Essex, every 4 out of 5 residents support community water fluoridation, and this is based on 2 different studies conducted with almost 1,400 residents. I understand that you have received many correspondence, and I'll leave you with my recommendations right up there.
Johnny Johnson, President of the American Fluoridation Society.
Good evening, Your Worship and members of the City Council. I want to thank you for allowing me to speak before you tonight. My name is Dr. Johnny Johnson. I'm a pediatric dentist in Florida, down south somewhere, and I wanted to let you know why I'm here. I'm a private practicing pediatric dentist of over 30 years. I have seen the benefits of fluoridation, and I have seen the horrors of the absence of fluoridation. You have a patient walk into any one of our dental offices, we can tell you if they were born in a fluoridated area or not. It's that stark of a difference. Cavities happen at a much greater rate, and larger cavities happen in a greater rate in a non-fluoridated area versus fluoridated. You're seeing that here in Windsor. They're seeing it in Calgary, where they have seen a 146% increase in just 3 years from 2011 to 2014. When they stopped it, those are unacceptable risk to take with people's lives, because people do die from abscessed teeth. Now, you may be asking why I'm here as the American Fluoridation Society representative to speak with you when you have excellent people from Canada that can answer these questions. Well, the misinformation you've already heard here is why I'm here, because it emanates from the United States, which I am saddened to say. The anti-fluoridationists, the Fluoride Action Network, use misinformation, cherry-picked tidbits of information from credible evidence, credibly conducted science, to pluck out what they want, mix in their opinions, throw it in a blender, then pour it out over people that do not understand science. That is criminal. You should not do that to people that do not understand, and Dr. Google, College of Google, is only going to pull up the most pulled up sites. As Dr. Charles said, Frank said, please depend on experts. No one can be an expert on everything. When you look for a bridge to be built, you turn to your experts in your building department. You don't turn to someone on the internet and say, should we build it out of straw and mud, because that's the original type of things we did. You look to build it out of something that's going to last you 40 years. When you look to say you wanted to bring a Canadian professional hockey team here, you would not look at the person who floods the local skating rink and ask them how it should be done. You would look to the NHL and ask for those questions and guidance. My group is a nonprofit group. We don't take a penny for anything that we do. This is all volunteer, and we are funded by a dental foundation that allows us to travel to areas that need expert help for those that misrepresent the science. One of the things I would like to point out quickly is that this is the National Research Council book from which plucked information was presented to you a few minutes ago. This has to be done. This study is done every few years to see what is the maximum amount of fluoride naturally occurring in the water that is safe to drink in the United States. There are 200,000 people that have fluoridated water that is between 4 to 16 parts per million. The EPA, Environmental Protection Agency, has historically set it at 4 parts per million. That is 6 times what you had in your water. What did this group find? Hardy Lineback was one of the 12 members on this group. What they found was that there was no health problems whatsoever. The only health issue that occurred was enamel discoloration. There was no cancer, there was no thyroid problems, no reproductive organ issues, none whatsoever. Hardy Lineback signed off, that unanimously was signed off, that document was. He may say what he wants to by plucking information out, and he does, but he signed off on a document that said the only thing that happens is severe dental fluorosis, which is brown staining. I put it in your packet that you had. It does not occur from fluoridated water at 2 parts per million from 4 to 2, it goes away. That's 3 times what you had in your water. You do not get stained, ugly teeth from fluoridated water. To summarize, I ask you this. When you had the CDC and Health Canada say not to eat romaine lettuce, did you eat it? Mm-mm. Why would we not trust them on this as well? They're not here to lie to us about fluoridation. Thank you very much, and any questions I'll be happy to answer.
The delegations, members of council, questions of the delegates. Councillors Bordelin, Kuzmirchak, Geniak.
Could I please have Dr. Ahmed and Tamara Stomp up, please? Start as Tamara's making her way up, but I'll start with Tamara first, just a couple of questions. So you mentioned in your opening remarks that you were an elected official in Kingsville. You also work in Windsor. And some of the comments that you found. So I want to go to the comments specifically that have to do with the political and the representative side. So you made comments that as councillors we would be held liable and that we would be held responsible, comparing it to Walkerton and Flint. So as an elected official with years of experience and as a lawyer by trade, do you actually believe that and know that to be true?
Absolutely. That's why I had to attend the program. And it was put on at AMO. And I got up early to go to this because I am a lawyer and I'm concerned about liability. That's what's happening at Walkerton. That's exactly what happened at Walkerton. That's the reason they put that in the legislation. The second thing is that it's happening at Flint. It's happening all over. There's an outstanding court case in Peel.
So you're comparing the fluoridation of water and specifically the Fluoridation Act, which is an act under the municipal code that entrusts municipalities to actually include fluoride or not in the water. So you do realize that it is our purview as elected officials to actually do this. So it's not something that we're going to be held liable for.
Nope.
Do you understand that?
Well, if someone is able to mount a case to prove that it is detrimental to them and they had the resources with which to mount that case, this is a completely litigious day and age. So if someone with fluorosis or kidney wants to bring an
anybody
action,
can decide to sue anybody.
Yeah.
But you came up front and as a delegate, in essence, saying that we would all be held liable for a decision to include fluoride back in the water.
That's what they
as
taught me.
individuals, not as councillors.
That's what they told me, that you have a municipal liability, so you're relying on your...
Who's they?
The 2 seminar leaders at the AMO program. So I'm sure you've had it on your list to do, have you not?
So I will ask administration later for clarification to actually show, but I did want to bring you up because I wanted to clarify for those watching that is not actually true, and that as a council doing the due diligence, listening to our medical officer of health, the Ministry of Health, the Health Canada, that these are all more than doing our due diligence to actually do this. So thank you for coming back up.
So just to comment that would be your argument against being held liable. That's correct.
So thank you, Dr. Ahmed. So you had a quick 5 minutes that you were sort of rushed through, and I wanted to get to a couple of questions. So one of the issues that someone raised was the complications that ingesting fluoride through their water would do specifically for liver issues or things like that. Can you comment to some of the other health concerns that people have raised as far as what seems like issues that ingesting fluoride would cause issues with some other problems like liver issues?
So I'll start off with that there is overwhelming evidence and decades of research that shows the effectiveness of community water fluoridation and the safety. This is a recently conducted document that is in your agenda package, which is conducted by our own Public Health Ontario, which is the scientific body that provides all the scientific evidence for public health departments in Ontario. And they have recently conducted this study. We take everything seriously as scientists. We want to look at the evidence, what is out there. Every evidence, every research paper that is published, we try to look at it and make sure that the research is conducted properly and the conclusions that are being drawn by those scientists are valid and it is applicable everywhere. Based on this recent document, there is no evidence to support any of the claim that was made. And if any of those claims were true, 73 years of community water fluoridation, we would have seen many more health issues that people talked about.
Can you speak to some of the issues that I believe it was Krista, the dental hygienist, that had just mentioned about the concentration levels versus, and when we're talking about fluoride as the chemical in its chemical state, as opposed to adding it and putting it into the water supply over so many parts per million. Can you speak to those differences?
Definitely. So there are guidelines that the Health Canada sets up in terms of the maximum acceptable concentration of fluoride in the water, which is carefully monitored and set to an optimal level that is shown to be beneficial for the health, oral health of the individual. And it all depends on the concentration. Any element that you take up, even as Krista mentioned, vitamin A, any other nutrients, if taken in larger quantity, it may be harmful. And same as with fluoride. And that is why it is strictly regulated, is strictly monitored every time, every water treatment plant operators, they look at the concentration very carefully, and any adverse event, it is monitored and reported and corrected.
So looking at I think the final number mentioned earlier was 0.07 parts per million. In that form, even if it was going to higher at 1 or 1.5, is there any concern for as far as the negative health implications at those levels?
And definitely not. The levels are set intentionally to provide that cushion that if for any reason the concentration is increased, there is no harmful effects to the health. The harmful effects are only seen at much higher level, 10 to 15 times of the level that is in our community for water fluoridation. And that is the reason that 0.7 is chosen as an optimum level of fluoride in the water that is shown to be beneficial and effective for the oral health of the individuals.
Okay, thank you. And you seemed rushed at the end of your presentation. Was there anything that you did not finish in your presentation that you wanted to share with us? I think it's important to have our medical officer of health represent all the facts here for the community.
So I've heard many of the conversation, and especially when it comes to the effectiveness and talk about the bioethics. And as I presented myself as the public health specialist, there are differences when it comes to the public health ethics and the biomedical ethics that you're presented with. And as the council member, you have the responsibility to not only the residents who are sitting in front of you, but also the residents that are in the home. So public health ethics is focused on the equity. It's focused on the benefit of the community. And that is what we are advocating, that our community needs our attention. Some of the recommendations that we are putting forward, those are all based on community needs, and those are not based on my personal opinion or how I feel about it. It is for the benefit of the entire community. There are different levels of intervention that are out there, and as we said, that there is no single strategy that will take care of all of this problem. We need multiple layers of strategy. We need individual level strategy that focuses just on the education and education and prevention piece, which we are doing, and we know that it is not that effective. And there are changing individual behaviors. Obviously, it's not easy, and it's cost intensive as well. Public policies are developed and designed to provide the maximum benefit to the entire community, and that is what we are saying, that in terms of the level of intervention and their effectiveness, the community water fluoridation provides the best protection in the community that we are living in, and it gives an equal chance, fighting chance to everyone who is dealing with these dental health issues. And the data clearly shows that our community in particular has much more dental health concerns compared to the comparable communities such as London, Niagara, and Hamilton.
Thank you, Dr. Ahmed. I've got a motion at the appropriate time.
Councillor Kuzmierczak.
Thank you, Your Worship. Dr. Ahmed, thank you very much for all the excellent work that you've done, and thank you very much for bringing our attention to this absolutely important issue in our community. So thank you to you and your team as well for bringing this information and this data forward. I have no medical training, no scientific training whatsoever, so some of the questions that I'm going to pose to you may strike you as a bit naive, so I hope you bear with me. I wanted to ask you, what is in your opinion, what are the primary drivers of tooth decay in the community?
So
And
there,
the reason I ask this, just to put this into context, there's other communities obviously around the world that are having this exact same debate as we are here today. And I was looking at articles from Australia, for example, and we know that Australia has a national fluoridation program. They provide fluoridated water to about between 70 and 90% of its population. But you look at articles from the Sydney Morning Herald and other Australian newspapers, and they're dealing with the exact same crisis. They're calling it a tooth decay crisis. And there's one headline I'm looking at right now, the Sydney Morning Herald, that states, "Dentists plead with parents to reduce children's sugar intake." What are the primary drivers of tooth decay in communities like ours that don't have fluoridated water, and in communities like Australia that do have fluoridated water?
so you mentioned about the various debate that's been going on in the community. I'll just make a quick comment on that. I just want to present the stats. There are 72% of the communities in Ontario that receive fluoridated water. So there is the majority that receives the fluoridated water. Now going back to some of the factors that may impact oral health, and I don't want to step on any of the dentists. They are the experts here. Maybe they can have more insight to it. But oral health of any individual is impacted by many, many factors. Behavior is one of the factors, education is one of the other factors, diet is another factor, and also the preventative care and the treatment that they receive are another factor. So our recommendation touches on each of those individual factors. And our recommendation touches on education and prevention piece, our recommendation touches on the availability of these services, and our recommendation touches on the community water fluoridation, which is the most equitable and most effective and cost-effective way of providing some benefit to these individuals. And as I said earlier, there is no one intervention that would take care of it all. We need to work on all those fronts. And there's lots of misinformation out there, and we need to make sure that we are providing our recommendations based on best evidence that is available and to the benefit of the entire community.
But it seems to us from our friends in Australia that putting fluoride in water doesn't stop or limit this crisis from growing, because they're having the exact same conversations we're having here today. Is that correct? Or?
Well, I don't know what's happening in Australia, but what I can say is this debate, there's been a lot of this science that is being used and cherry-picked in terms of where this conversation is going in. This conversation ends in having fluoride or not fluoride, but the issue is oral health, and we need to pay attention to it. We know fluoride is protective, and that is why it is there. And as I said, there are multiple factors that impact the oral health of the individuals. One of those factors are their educational level, their availability and access to preventative dental services, and their behavior in general, their diet. There are so many other factors which goes into the individual level of details, which would be very hard to consider in making any population health level recommendations.
The articles that I was reading from, again, countries like Australia or the UK that do fluoridate water, they're finding that a third of children are not brushing their teeth properly. Only about 1/5 of kids actually see a dentist before the age of 2. I know the recommendation, I think, in Canada is to see a dentist before the age of 1. Is that correct?
That is correct.
A quarter of the kids are put to bed with a bottle, leading to what's called the baby bottle syndrome. The long-term exposure to milk overnight apparently has an impact on caries as well. And also the increase in sweetened drinks like juices, chocolate, and yogurt. So there's a lot of drivers in the community outside of the fluoridation debate that are sort of fueling this crisis. Is that correct? Both in communities that have fluoridated water and in communities that don't. Is that a fair assessment?
Well, when we compare ourselves with other communities, even in Ontario, I don't want to go internationally, but there are communities that have fluoridated water. There are communities that do not have fluoridated water. And even when we are looking at them, our rates of decays are much higher than compared to those communities. So we can say that there are factors that play into in oral health, which education is one of the factors, and we want to make sure that we are spending and investing time on educating the community to make sure that they are taking good care of their oral hygiene and oral health. But that is not the only thing that was going to change everything.
Now, you mentioned that 70% of Ontarians have access to 70%.
72%.
72% of Ontario residents have access to fluoridated water. What's the proportion in Canada, for example? Because I read somewhere that it was about a third have fluoridated water. Can you
So-
confirm or
The outliers in the community water fluoridation is Quebec and British Columbia, which is pretty good, pretty big in number, and Quebec has the lowest lowest percentage of people who are receiving fluoridated water, and that is,
what is that percentage, Doctor?
I believe it's less than 10%.
Okay, less than, in Quebec, less than 10%.
In Quebec.
And then you mentioned BC also does
Yes.
fluoridate. What's the numbers there?
I don't have that, but it's also less than 10%.
Less than 10%. Okay, great. So, if I can just bring your attention to the oral health report. Again, phenomenal report that indicates that we do have an issue here in the community. Again, I commend you for the work here. In the oral health report, I'm looking at that would be page 429 of 485. This is the screening outcomes for children in schools in Windsor, Essex. This was the screening that was conducted over a 5-year period from 2011 to 2017. I'm not sure if you have that on the screen, but
No, I don't have
that's
that on
okay.
my
That's
slides.
okay
Yeah.
if you don't. So the question that I have is, you provided a really startling statistic that the number of children that did not require dental care decreased by 43% over the 5-year period. Is that correct?
It increases the dental health needs of the children's. It has.
Yeah, I think it says here no care required, and the number of children that did not require care went down by 43%.
No, that is not.
That did not require care, so no care required.
So we're looking at page number 31.
This is 429 of 485. I do apologize. That's the page number that I have on the agenda.
Do you have the figure?
This is
or
table
the-
7. Yes,
Table 7?
Table 7. It says the percentage of children where no care was required. In 2011, it was 79.9% of children where no care was required, which means that they're healthy. And that went down to 45.3% in 2016-17. Does that kind of jive? Am I reading that correctly, or?
So I'll have to invite my colleague who may be well versed with the program that we offer and the children who see that, maybe.
Sure.
Okay, so hi, I'm Nicole Dupuy. I'm the
Hey,
Director
Nicole.
of Health Promotion. So what you're referring to is the number of children in need of care has gone.
No, I'm looking at, this is
No
table,
care required.
Table 7, and it says no care required. So in 2011, we were doing pretty good. It was 79.9% of children where no dental care was required, so they're healthy.
Right.
And then that number drops precipitously in 2016, 2017, down to 45.3%.
Correct.
Okay, so I'm reading that correctly.
That's correct. So there's less children that have healthy mouths.
Exactly.
Yes.
Right. So the question that I have is so over this 5-year period, you're looking at an average decline of about 8%. But what kind of struck me a little bit is the greatest decline in healthy mouths took place between 2011 and 2013, which is before fluoride was removed from the water system. And this was represented a 15% decline in oral health in both of those years. That's the largest, that's the steepest decline. And this happened before water was removed, or excuse me, fluoride was removed from the system. So I guess I'm just trying to understand, again, going back to my original question, what's driving this crisis that we have here? And it seems like the decline in the health, that precipitous decline, that accelerated decline, was taking place before we removed, or fluoride was removed from the system. And I'm wondering if you could explain that.
So Dr. Ahmed could probably add to it. We also have epidemiologists in the audience who could add to this. But generally, when we don't look at year over year. So what we've provided to you is year over year, but from a health perspective or health unit perspective, when we're looking at data, we're looking at a trend. And I do believe that the health unit had said previously how long would it take to see changes, and at least a minimum of 5 years is that standard. Because lots of things go up and down year to year, it's very difficult to explain specifically why one thing goes up or something goes down. So we do look over the whole period, and so we look for change over time. And then we provide an analysis or look at statistical difference. Like, would that be a change that we would expect, or is it something outside of what would be expected?
And I understand that, but what I'm seeing from these numbers is we were on an accelerator, I guess you could say, you know, in terms of or escalator, I guess you could say, in terms of the escalating crisis in the community before fluoride was removed from the water. So what's happening in our community that, again, even before fluoride was removed, we were seeing this increase or decline, I should say, pardon me, in oral health?
I think you said it right, and my colleagues here would probably agree that and Dr. Ahmed has already said, there's multiple factors that contribute to poor oral health. Many of them have been mentioned. Diet is one of them. Good oral hygiene habits is another. Access to care, treatment, insurance is another factor. Preventative services is another. So it's very difficult to answer sort of your question specifically about what is the specific issue. If you're asking about fluoride, as it's been mentioned, it's one preventive measure. It's a very important preventive measure, in particular from an equity perspective. It gives everyone at least the beginning baseline. It doesn't replace good oral hygiene habits. It doesn't replace good diet. It doesn't replace access to a dentist. All of those things need to happen to really see good improvements in our community.
And just to add up to that comment, and we already know that dental health insurance and availability of preventative dental health care impacts the oral health. And if we go back to with the history of Windsor, 2007, 2009, when the recession hit the community, a lot of people lost jobs, went out without insurance, and so that could be one of the factors that you may see as a result of not getting to the dentist. Their oral health declined at that time, probably the reason because of the access, and then it continued. And I think what we need to pay attention to is the trend, and that is where the population health expertise comes in epidemiology. That if we are looking at the year-to-year data or month-to-month data, we may see lots of variation going up and down, and that is why the trend is important to note and to pay attention to.
So would you agree also that that population, is it possible that population changes have had an impact on sort of the numbers? And the reason I ask is the Canadian Academy of Health Sciences basically states that immigrants experience or newcomers experience more negative oral health outcomes. And I think that's something that was mentioned here this evening. And we know that in the last 5 years, Windsor saw an increase of 10,000 newcomers. These were immigrants, for example, that have been in the country less than 5 years. And we know that 40% are refugees, compared to 15% across Ontario. We know that, for example, Iraq and Syria represented 20% of newcomers, respectively. And we already know that Windsor has a high population of immigrants, 27.8%, which is significantly larger than the population of immigrants across Ontario and Canada. So this influx that we're seeing as well, is it possible that that could be also contributing or driving some of the data that we're seeing as well? I'm just curious.
We definitely looked at the data to take that into consideration with the immigrants that came into our community, and the data showed that there is no immigration effect on these dental health. Many of these analyses are done at the school level, and we know in our community at every school, these immigrant population are dispersed in every school. What you're looking at is the average of all the children, and that's why I made a point that we looked at the amount that every child in the city of Windsor and Essex County. So it's not just the one school that we took a sample and then we compared it with every other kids. We looked at the amount that every kids that are attending the school. And based on that, even when you factor that immigration part in, how many children are going into school, how many children are assessed, because these assessments are done on JK, SK, and grade 2 only. It's not done on each and every grade student that people are attending. And these immigrants, when they're coming, how many of them are going to JK, SK, and grade 2? And then when they're spread out across the city, there is no effect of their immigration on the oral health, overall oral health report.
I just want to add on to Dr. Ahmed's point. That's correct. So you're talking about JK, SK, and grade 2, so about 15,000 children. So the number of actual children, new immigrants or refugee children in that age group is so small, it doesn't have an effect. Okay. But they do have an effect They are residents, and they do matter when it comes to decisions.
Right.
So to your point that they may have increased oral health needs, I think is a really important point when you're making decisions today, that you do have a lot of residents, including new immigrants and refugees who are now residents and citizens of Windsor, who these recommendations matter quite a lot to.
So when I was doing my research, I was looking for a success story. And I came across a program called the Child Smile program in Scotland. Are you familiar with that program, Child Smile in Scotland?
No, I'm not.
So really quickly, they about 6 or 7 or 8 years ago, they were having the exact same debate that we were having here today, to fluoridate or not to fluoridate. And they decided, the national government in Scotland decided they wanted to go beyond the debate of fluoride. And so what they did is they created a program called Child Smile. And what it does, it provides children in daycare and elementary schools in vulnerable neighborhoods, provides toothbrushes and toothpaste, which is what we do in our community. It provides twice annual fluoride varnish applications. I'm not sure if we do that. And it also provides, which I thought was quite innovative, it provides daily supervised brushing in the daycares and in the primary schools. Daily supervised brushing. And a government report found that the Child Smile program increased the percentage of children with no tooth decay from 54% in 2006 to 68% in 2014. So dramatic improvement. So while other countries were seeing a decline, regardless of fluoridation or not, Scotland was seeing a dramatic improvement in oral health in children because of this program. Is this something that we could implement here in Windsor and Essex? Is this a strategy that we could implement?
So let me just comment on the providing the toothbrushes and toothpaste. We do that. There is a program that gives out these toothbrushes and toothpaste to vulnerable children. There is a fluoride varnish program that is implemented in our community, and we do that through, there's a provincially funded program that provides fluoride varnish to children. And when it comes to providing support for, as you said, that helping them brush, it's great. But when we are looking at the population level health intervention, how much it costs. So think about it as if we cannot just say that the responsibility is on them. What are we doing as there for the community? It's about equity. And if we have the funds to do that, that's great. But I think it just goes back to the question of whether it is how much money it costs and how effective those interventions are. And public health interventions are basically recommendations based on the cost effectiveness and the relative effectiveness in the community. And this is what we are recommending. If this can be done, we'll support that. But as I said, there are multifactorial things that we need to consider. These are all the individual level interventions that you can do. And if those individual level attentions have limited impact, and if that can be done, it's cost intensive, and it would definitely show some positive benefit.
It works. It seems to have worked in that country. That's, I guess, the point that I'm trying to make. One final question, just again, a quick question. There's so much literature out there, and honestly, the last 2 weeks, I've read so many journal articles, medical journal articles, dental journal articles, you name it. And there's some good articles, and there's some not so good articles. There's good methodology, not so good methodology. But there's 2 studies that caught my eye. I just wanted to get your comment on it. So there's 2 studies that were published in 2017 and 2018. Both were published by the University of Toronto. And they were published in partnership with Harvard University, University of Michigan, Indiana University. They were sponsored by, I think it's the National Institute of Health. And what they found in both of those studies is that there was an association between exposure to fluoride in pregnant women and elevated incidences of ADHD and lower IQ among their children. And what was really remarkable about this study is that they actually followed 213 mother-child pairs from pregnancy, and they tested the children, for example, at age 2, at age 4, at age 6, at age 10. So this was a longitudinal study. And the findings, and I'm trying to quote here from one of the lead authors, the conclusion was, our findings are consistent with a growing body of evidence suggesting that the growing fetal nervous system may be negatively affected by higher levels of fluoride exposure. They're not saying this is fact. They're not saying that they're not making an absolute conclusion, but what they're saying is we need to we need to investigate this more. There's enough grounds. The methodology seems to be fairly solid. There's enough grounds here that we need to do a little bit more research. Can you comment on that, on those two studies?
Sure. As I mentioned, this document is recently prepared by Public Health Ontario, our scientific body, and it touches on specifically on those studies. And I would just say that the studies, and I'm quoting as verbatim, these studies were critiqued by other researchers for methodological limitations, including measurement error and no consideration for other potential explanatory variables such as preterm birth, exposure to tobacco, alcohol, arsenic, or lead, apart from socioeconomic status. The results are advised to be interpreted with great caution due to the high risk of ecological fallacy. Water fluoridation is measured at the state level and confounding biases. And as you know, Councillor, anytime when we are looking at any study, confounding and bias is one of the most important things that we have to look to make any kind of meaningful conclusion. And based on the methodology, if those questions are raised, it raises doubt in terms of what the conclusions, how the conclusions are being drawn, and whether it can be applicable to other communities or other individuals. And this, refer back to this paper, this conclude that there is nothing to say that it caused any concerns in the neurodevelopment or ADHD, and this is also proven by the European Union for Scientific Community and Health Research. They also said exactly the same thing, that fluoride in drinking water at levels permitted does not impair children's neurodevelopment. So we do have those recommendations right in those documents.
No, absolutely, and we know association does not mean causation.
Exactly.
And the researchers themselves, they don't purport to state that it causes or that this is conclusive or whatnot. But I just found it interesting that they seem to imply that they're raising some questions that need to be investigated.
As I mentioned earlier, we do take all the scientific evidence very carefully, and we look at those scientific data and use our best ability to gather all the scientific evidence, all the scientific bodies who are expert in those areas, and make recommendations. We are using all their expertise, collective wisdom of all those agencies, collective wisdom of all those individuals who are conducting those research, and present those recommendations in front of you.
Thank you very much. Thank you, Doctor.
Thank you, Councillor. Just a point of fact, Toronto has the highest rate of immigration, not Windsor. Just clarify that. Councillor Gignac, please.
Thank you. Dr. Ahmed, don't go away. Thank you. I appreciate the advice that you're giving to Council this evening. And I just want to make sure that I am summarizing correctly. Do you consider fluoridation to be a good tool for municipalities to use in promoting dental health?
Yes. Community water fluoridation is safe and effective, and it has proven to show benefit when it's added at the optimal level. It benefits the entire community and prevent dental cavities.
And your advice to us would be to put it back into the water?
Yes.
Thank you. Secondly, the studies that you've presented this evening were very comprehensive. I assume that you began collecting data right after we discontinued fluoridation of the water. It's just children that we're seeing that info on, though. Do you have any statistics in regard to elderly, the elderly population in our community, and the impact of removing fluoride from our drinking water on their oral health?
So we do the oral health assessment of all the children in the school system, and that is why we have a much higher and comprehensive data on those students.
Right.
And that is what we presented. We recently conducted an oral health assessment, a survey-based questionnaire to all the adults and seniors in the community, and we recently published that report last week. And the reports are still concerning, and I didn't present that report to the council, but it shows exactly the same story. The oral health of our seniors and adults and seniors in our community is also deteriorating rapidly. There is no systematic way of collecting that data. We have heard from the dentists what they are seeing, what we have heard from our community members in our survey. It is exactly the same what we are seeing in the children's. Their oral health needs are continuing to increase, and in the absence of any preventative oral health treatment and care, their health will oral health will continue to deteriorate, and they will develop more complication, results in more healthcare system utilization, inability to pay for dental services, and they may go to extreme actions to take care of their problem.
Thank you very much. Dr. Frank, could you come up and speak to the issue of the concerns amongst our seniors? It's interesting in the last, and I know my colleagues around the table have been getting emails and phone calls, the same that I have, from constituents and from people further away. But I spoke to several individuals, 3 in particular, who pointed out to me that they had recently had to pay visits to their dentist because of pain. And they indicated that after x-rays, it was identified that they had problems beneath the gums. And these are older people. These are people in their 80s and 70s. I'm wondering if we, can correlate that to the removal of fluoride from water and how that would penetrate around the gum line. Are these issues that you're seeing more regularly?
In my patients in general, I've seen a greater frequency and breakdown in the dentition and the teeth there. The fluoride works, on the surface. It's also incorporated as the teeth are formed. But when you get issues below the gums, it could be either because of periodontal problems, which is issues around the gums, or it could be because of endodontic problems where decay has permeated into the tooth and devitalized the tooth, resulting in an abscess, which that could be directly attributable or connected with the fluoride. But periodontal conditions are not affected.
And so in your opinion, and you've been practicing for how long, Dr. Frank?
33 years.
33 years. Again, I'll ask you the same question that I asked Dr. Ahmed. Would you consider fluoridation of community water to be a good tool?
Absolutely.
And you would recommend that we put it back?
Yes.
Thank you. Krista Dufour, if I could, please. Krista, you were kind of rushed at the end of your presentation, and I found it very informative, so I'm going to ask you if there's anything you wanted to add to the comments, or did you want to finish any of your comments?
I started a business bringing dental hygiene care into long-term care facilities because there's a need. There's a great need. It's my understanding that I'm the only oral health care provider in this city and surrounding areas that's doing this right now, which makes me very sad. And actually something that I believe Dr. Oper said was that, it's not enough. What I'm doing is everything that I can, and it's not enough. I know that community water fluoridation, it's one thing that we can do that can reach everybody, every single person in this community. And I think that when we make these decisions, we have to consider the voices that we don't hear, which is, residents in long-term care and young children and vulnerable populations, because they're the ones that are most affected and in need of preventative services. It's not, I don't believe that water fluoridation is the only answer, but I believe that it's needed and that it can help, and that we should do what we can to help all of the members of our community, especially the vulnerable ones.
I appreciate your comments, and certainly they seem to resonate amongst a number of the delegations insofar as recognizing that fluoridation of the water isn't the only thing that's going to address this issue, but it's a darn important tool. It's a consistent tool, and as Dr. Ahmed said, the education component is important, the fluoride is important. In visiting your dentist, making sure that you start that early. but I appreciate the comments around seniors. If I could, Joyce Zuck, just in regard, Joyce, to your comment about the fund, if you could share perhaps if there is, I guess, a real startling number that you've seen in regard to demographics. You said your fund is running out quickly.
The fund is only between 40 and 50,000 per
Right.
fiscal year, so it's a relatively small amount. What I can share with you that 50% of the fund has been allocated to assist residents in primarily Windsor and some in the county with issues around dental care. Looking at augmenting the services that might not be covered by Ontario Works. Often we can get an extraction funded, but our preference is always trying to save someone's teeth as opposed to pulling them. You would agree with that. I'm not an expert on teeth, but I have a full set. I intend to keep them.
Well, I think we all
And
agree
most
to
folks
that.
want to.
Absolutely, absolutely. So that's a trend you've seen going up in the last 5 years.
Yes, and I wish that I could tell this council, because I think it would be perhaps most impactful to say that it's primarily children that are accessing that fund, but because of programs like the Healthy Smiles, it's mainly adults and seniors that we are working with.
Perfect. Thank you so much.
Councillor Costante.
Thank you, Your Worship. If I could call Dr. Ahmed back up, please. Just a few questions. Much of it's been discussed already. There's been an increase, 51% increase in decay rates in urgent care. And Councillor Kuzmierczak asked some questions about drivers. Would you agree that one of the drivers is the lack of fluoridation in the water?
Yes.
Would you agree that it's a significant driver?
It depends on the individual, because as I said, there are multiple factors that plays into part in any individual's health. Some may need it much more than the others, and people who have access to all these services, who are good, educated, qualified people, who have access to dental health insurance and who have the money to pay for the dentist, they may not need it. But for the others who may have a challenge in accessing all of these services, they may need it more. So as a generalizing community, it would be hard, but it's something that as a community, everyone benefits.
Okay. And there's mention in the report the importance of oral health in children and the implications. Has there been any, to your knowledge, any studies done on student achievement and the correlation between student achievement and oral health that you're aware of?
Well, 73 years of studies on community water fluoridation has shown to be very effective in reducing dental caries, and it has been supported by all the leading health agencies across the world, in Canada, outside of Canada, everywhere. They all found a significant correlation of having water fluoridation and improvement in oral health. So the finding is consistent, and it has been reported everywhere.
Okay. But on the question on student achievement, are you aware of any link at all? I get the link between oral health and fluoridation, but is there an established link between oral health and student achievement that you're aware of?
By student achievement, you mean how they do perform in their education? Or, well, we know, again, that I'll bring my public health hat on it, and we know healthy child development is one of the most important things, and it's an important social determinant of health that helps children to achieve their full potential by having all the access to education and developing to their brain development, their ability to understand and then grow up to be a useful, productive community citizen. And all these factors are not necessarily linked to oral health, but it is one of those things. When a child is suffering from dental disease, cavities, there are other dental health, they have a hard time in going to the school, they have a hard time in paying attention to what's being taught, and then as they continue to get those information while they're doing it and develop other health-related complications such as abscess and other health diseases, that chronic diseases, which there is link when with cavities. Children who have cavities, they have a higher incidence of developing cardiovascular diseases and respiratory condition that is also backed by scientific evidence. And all those things are leading for us as a community to, if the children are developing all these complications and no one is taking care of it, they will all grow up and be the individuals in the society without getting to their full potential. And that will be a loss to the entire community. And we need to ask this question, that what are we doing for our children? Because those are the children that we are seeing. The trend is startling, it's disturbing, and these individuals will eventually grow up in our community and be the citizen of our community.
Okay, so could I quickly summarize? The introduction of fluoride would help mitigate against some of those issues with children, doing well in school and issues that they're having. Would you agree?
Yes, it will reduce the dental cavities, which will help them focus more on their schools and education, and will be a more productive member of the society.
Thank you. I want to go to the chart that Councillor Kuzmierczyk referenced. I've got it listed, I think it's 429 on the agenda. And I recognize the importance of trends, but I want to kind of drill in on two lines. First is under urgent care required and decay or urgent care required. Generally speaking, we've seen an increase of 1%, 1.5% year over year, at the very highest 2%, except for the years 2013-14 to 2014-15. I've noticed the highest jump. So when we look at urgent care required, you're looking at a jump of 2.8% and 3.3% when you're looking at decay or urgent care required. Any idea why there's a larger bump in that time period relative to the other years? And I recognize the importance of trends over 5 years, but any indication why?
Well, this is the data that we have, and one of the contributing factor could be fluoride, because that's the time when the city took out the fluoride. It may be a contributing factor, but I cannot specifically say that that is the only reason that we saw that jump.
Okay. I'm going to ask you a simple question because I don't have the pedigree that you do, and I've been on council for 10 minutes. Is there, according to the reports that you're relying on, is there any causal link between fluoride and other health implications that we've heard of this evening?
So I reference it back to this scientific evidence that is produced by the Public Health Ontario. There is no evidence to support any of those claims other than mild dental fluorosis at a higher level, and mild dental fluorosis have no impact on individuals' health.
And could you explain to us what mild dental fluorosis is?
I think Dr. Frank mentioned that as well. It's the white specks in the teeth, that it's just cosmetic and it has nothing to do with individuals' health. And over time, that is the only significant finding that can be related with having fluoride in the water. Other than that, there is no connection of any of these chronic diseases with fluoride.
Thank you. Thank you very much. Just very quickly, Ms. Stomp, please. Ms. Tamara Stomp. Hi, good evening. Ms. Stomp, I just want to clarify, because you've stated that there's a potential of criminal prosecution if we go ahead and vote in fluoride. Am I stating that accurately? Quasi-criminal prosecution and civil. And you're relying on 2 people at a conference that told you that? Okay.
No, I'm relying on the section of the Act.
Of what Act?
Safe Drinking Water Act, Sections 19 and 20 came into effect December 31, 2012.
Okay. Are you familiar with the Fluoridation Act?
Yeah.
And are you familiar that it's a provincial statute?
Yes.
And you're familiar that municipal bodies are actors, creatures of provincial governments, right? And would you be relying on any case law at all to make those assertions? Because it's a lofty assertion to make, especially as a legal professional.
Oh, it's a fine assertion to make to be able to read as a legal professional.
Are you relying on any precedent?
You can read it as well as I can, and that was what we were taught, was to be concerned for personal liability. that that was what was done when it came into effect. It had personal liability.
Are you aware of any precedent?
Any precedent that anybody's been prosecuted criminally under it?
Sure.
Walkerton?
Are you aware of a case out of BC, Millership versus British Columbia?
I'm sorry, I didn't hear you say it correctly.
Are you aware of a case out of BC called Millership v. British Columbia? Are you aware of that case?
Millership?
Yeah.
No.
So it's a seminal case on liability, and I'll reference just a section of it. And I just want to state this, just for the comfort of counselors. However, the predominant opinion is that public water fluoridation is effective for the purposes of reducing dental caries. And aside from dental fluorosis, if the levels are not excessive, the evidence does not indicate that the health risks complained of are caused by consumption of optimally fluoridated water. This is a seminal case that's being relied on.
As a defense.
But you're making an
That's
assertion based
why.
on zero cases.
No. I'm saying I don't know of the cases. You know of that case, and that case, that was the defense relied on, ergo, somebody brought a case.
Yeah.
And yes, I do expect you to use your due diligence and all the legal information that, or the medical information and the expert information that you've heard here today. But when this was dealt as your defense, I would hope that you do. If you didn't, you don't have a good lawyer. But will there be a day when the standard changes? That is the concern. I hope that it doesn't overshadow you and you stay awake at night in your deliberations, that's for certain. But I do believe it's an obligation of mine to point it out and to be careful about it, because the experts who have advised you also in 2012 were the CAO, Mr. Stewart. He's an expert too.
Okay, thank you. Thank you, Mrs. Tom.
You're welcome.
Councillor Kaschak.
Dr. Ahmed, thanks for your time tonight. Would you say that poor oral health links to other poor health issues in the community?
Yes.
There's a statement that every $1 invested in the community with water fluoridation, that $38 is saved in dental treatments. Would you think that's correct? Or
that is correct.
Okay,
yes.
Good. Dr. Frank or Dr. Oper, Dr. Oper, could you come up? Well, Dr. Oper's coming up. Can you talk about other chemicals in the water system, Dr. Ahmed, and their harmfulness to the citizens, the residents of Windsor?
So there are drinking water quality guidelines that are produced by Health Canada, which monitors and regulates all the chemicals that are found in the water, and making sure that these chemicals are not above the minimal acceptable concentration. Any deviation from that minimal acceptable concentration, there are protocols and procedures to rectify that, so that the community is receiving a safe drinking water. And all of those chemicals that are commonly found and are known to be harmful for health are strictly regulated and monitored.
Right. Would you think that something like chlorine would be much worse for people than fluoride?
Sorry, say that again?
High amounts of chlorine in the water would be worse than fluoride for people?
If chlorine in a high dose, in a high quantity, it can definitely affect the health of the individual if they're exposed to it. Mm-hmm. Chlorine in the water is essential, and it's maintained at a level which keeps the water free from any of the bacterial contaminants that we find in the water.
Proper levels, yes. Yeah. Dr. Oper, talking about fluorosis, do you see much of that now in the last 5 years since fluoride has not been in the water in Windsor?
It would be hard to quantify the amount of fluorosis that's seen. Mild fluorosis is very common on dental examinations of children with erupted permanent teeth.
Right.
Is it severe? No, I would, at least in our community, we rarely see one with severe fluorosis.
Mm-hmm. Mm-hmm. So would the statement that cavities would be worse than mild fluorosis be correct?
One of the things that we see when it isn't a total number of cavities. What we're really seeing is the severity of the tooth decay. We see children that have cavities, but instead of fixing the tooth very simply, very conservatively, you're now looking at placing stainless steel crowns and doing nerve treatment on the teeth. So that what we've found during the period of the last 5 years is an increase in number of children who need very aggressive dental treatment compared to perhaps what we saw 10 years ago.
And would you say that's a lot because they're not brushing their teeth enough? Huh?
Well, as Dr. Ahmed said, toothache is really a multifactorial disease. And there are a multitude of factors that have changed in the last 10 years that impact dental decay.
I guess I go back to when I was a young boy, and I did not like to brush my teeth. Probably went a couple days at a time without brushing my teeth, unfortunately. But I never got any cavities. In the 1960s, there was fluoride in the water, and I got a feeling that that might have been part of that, part of my luck, maybe?
I would say that it's certainly a contributing factor. One of the things that we've addressed tonight is changing diets. You have children drinking juice and eating foods that are high in sugar.
Yeah, I wasn't allowed pop and stuff like that too often, but I drank a lot of water, so I just thought there might have been a correlation to that.
I would think so.
I appreciate that. Thank you.
Councillor Francis.
Thank you, Worship, to Dr. Ahmed. And I'll try to be quick out of respect for everyone else's time and other people wanting to ask questions. Dr. Ahmed, I don't want to litigate this. I don't want to say you're right, someone else is wrong, or vice versa. That's not what I want to do here tonight, at least from my end. I understand this was a decision made 5 years ago. 5 years later, we're here to assess the situation. Perfectly logical, perfectly right thing to do. What I need help with, and what I'm having trouble with, and I have to make a final decision on this tonight, right? I have to decide, do we remain status quo, or do we reintroduce fluoride? I have the report in front of us, and we see that, you know, things have essentially gotten worse. But I don't see a direct correlation. And from what I heard tonight is there is no direct correlation. It's a contributing factor, but there are other contributing factors. There is no one direct correlation, is there?
You're right, there is no direct correlation, but there is a direct correlation when you have community water fluoridation. It prevents dental cavities. That's the direct correlation.
Right, but as it results to the situation over the last 5 years, you can't tell me with 100% certainty this is because fluoride was removed from the water supply.
As a responsible public servant, I would rely on the scientific part of it, and we know that there is not enough data that we can use to make that judgment, but we can definitely see the trend where it is heading, and it is my responsibility as the medical officer of health to bring you back the evidence in terms of what is happening with the oral health of our community and what are some of the steps that can be taken to prevent that.
Okay, that's fair.
Yeah.
Now, are there any other contributing factors that should be added into this discussion that I'm not aware of? We talked about juices, other diets, other lifestyle features that might be the result of what we're seeing. But how do we correlate, or how do we, balance all the other contributing factors?
So we have our recommendation that touches on all of those things. So when we talk about the continue to support education and awareness in the community, that covers all of that. That has been happening since the removal of the fluoride when the council made that decision.
But has that been working? Because we're here 5 years later, and you're saying that essentially that hasn't been working, or at least to a satisfactory rate, because what we're seeing is worse than what it was 5 years ago.
Well, you're right, because education and advising people to to brush their teeth, it doesn't change their behavior. It takes a long time to change their behavior, and these are one of the things that we can do. But there are other things that people can receive fluoride in the water when they're drinking water, and it protects them and it protects their oral cavity. And it's one of the ways that we are providing support to those individuals who may not be brushing their teeth, but there may be individuals who are brushing their teeth and doing everything that they should.
Okay. So regardless of cost, regardless of efficiency and how difficult it is, what is the best way to improve someone's oral health, a child's oral health?
So our recommendations touches on each of those elements. We need to provide them with good education and awareness in how to take care of their oral health. They need good, strong support for preventative dental health services and access to dental care. They need fluoride in the drinking water, and all those factors would help them in having a good oral health hygiene and good oral health.
But assuming for an instant that they have everything they need, would fluoride in the drinking water still be needed?
Well, we know for a fact in our community what the situations are, where 1/3 of the population and children live below the poverty line, and we cannot be confident that this is the way. If we just take out the fluoride, everything will take care of on its own. If it's great that we can have all those other services in place, but in addition, right now, this is the best evidence that we have to improve the health of our community, oral health of our community.
Sure, but assuming that that child has everything they need, right, with respect to oral health care, they got the education, they have access to, dental care, would you still recommend to that child that you need fluoride in the water?
Yes.
Okay, so this is where my dilemma comes in. And you put up that chart with respect to the different levels of education, and this is, I think you said it's, it's the most difficult, the education, and the payout's not as great. So we go to the benefit for the entire community, the equity, right? But you have a lot of people here saying, I don't want it. So how do I reconcile that?
Our surveys shows 4 out of 5 residents in Windsor and Essex County, they want fluoride back in the water. That survey was conducted with more than 1,400 respondents. And obviously, as you know, the surveys have a limited, we cannot poll every individual in the community. 1,400 is a pretty big number compared to any of the survey that you can extrapolate it based on the community size of the community that we have, which is pretty representative samples. And if you look at that sample, 4 out of 5 residents in Windsor and Essex support community water fluoridation.
But essentially, your argument and the health unit's argument is this is the benefit for the entire community, regardless if you want it or not. It's good for you.
Yes.
I have a problem with that. And that's what I'm struggling with. And it's not, I'm like you. I'm trying to eliminate my bias, my ignorance, and represent everybody that I represent, understanding that there's significant amounts of people that don't want fluoride in the water, but there's other people that don't have a problem with fluoride in the water. I'm having a hard time reconciling that.
I totally understand it, and as the city councilor, you have a responsibility to all your constituents. But I am telling you, 4 out of 5 residents in Windsor and Essex support community water fluoridation. As a politician, you have to take those people who are supporting community water fluoridation as well as those who are not. And just like people say that I don't want it, there are systems that are available that they can put and install in their homes, and they won't get it. Depending on how many people are we talking about few hundreds, thousands, how many? And those are the individuals that I think we need to pay attention to. And any kind of intervention that is happening at the population level, it is based on the benefit of the majority. And the benefit of the majority, what we are seeing is a very steep decline in the oral health of our community, and we need to do something. And this is what.
But not to be argumentative, but I'd feel a lot more comfortable with that argument if there was a direct correlation. Because essentially what I'm being asked here to do is be pretty heavy-handed, right? Essentially as a public official, say, listen, this is what we're going to do because we think it's in the public's best interest, regardless of any other dissenting argument, right? And we can do that, but it's very heavy-handed in my opinion. Now, without a direct correlation, I'm uncomfortable going there.
We have the scientific evidence, which is presented to you in front of you, which supports all the arguments that we have made. We have the arguments that are in favor of community water fluoridation. You have that in front of you. And as the council members, I recognize and many decisions that you make is in the best interest of the community, not who is have the loudest voice in the community. You make decision that is important and that impacts the entire community, and I hope you do the same to benefit the entire community as opposed to just paying attention to some of those individuals.
No, that's perfectly fair. And as you would say, equity, someone said earlier in the presentation, autonomy, where there is still personal freedom. And I believe people should make that decision for themselves if they choose to have fluoride in the water or not. So I think that's just where we differ. And
there is the public health argument, and as in the public health ethics, and it's at the population level. You make decision where autonomy is often overtaken by the benefit of the community.
Right.
If you can make an argument that even if I am sick and if I have TB or something, and if I'm sitting in this room and infecting everyone else and say it is my autonomy that I want to sit here,
But
that
Dr.
trumps-
Ahmed, there's a
that
direct
trumps-
correlation to you having TB
There
and
is
infecting everyone in this room, wouldn't
There
there?
is no direct correlation with any adverse events related to community water fluoridation, and you have the evidence right in front of you.
That's the only thing. I agree with you, but that's... You got both sides of the gallery there, Dr. Ahmed. No, and I don't want to go back and forth because this is, I'm telling you right now, this is what I'm struggling with, right? And without a direct correlation, right, it's a little bit different for me. It's very different when someone's saying, I don't want to have fluoride. And the argument is, if I, for one, say I don't want to have fluoride in my water, right, then I can use other products with fluoride in it. But if there's fluoride in my water, I am limited and I need to use my tap water essentially. So that decision is essentially made for me. And without a direct correlation, that's a little bit more specific in front of us that relates specifically to fluoride in the tap water and not how much juices someone's drinking or their diet or something else. I'm just uncomfortable going there. But listen, I thank you for being here. I thank you for the report. And that goes for everyone. I think this has been a really well-educated group of delegates. So thank you.
Councillor McKenzie.
Thank you, Your Worship. And I'm going to echo some of the comments we just heard from Councillor Francis. I appreciate, first of all of the input we've gotten here this evening from all of the delegates. People have come from far and wide to help inform this debate and have brought insight and passion. That's certainly appreciated. And I have struggled with the question around consent. But I'm very moved by the data, Dr. Ahmed, and I do have a question for you that I've seen in your report. What moves me is and I'm going to ask you to comment on the socioeconomic factors that are, I don't think, clearly articulated in the report, and I'll ask you if, through the collection of your data, if you were able to correlate any of the, let's call them negative oral health outcomes with children or with other populations along the income spectrum.
So one of the table, and I'm just trying to find that table, it touches on the material deprivation index, and it is presented in one of the table. And it touches on the socioeconomic status of these individuals, and we can see the impact is much more in children who are materially deprived compared to those who have access. But we can see the trend in all of those socioeconomic status. So it's not just about individuals who don't have the means to get oral health. It is everywhere, and that is why community water fluoridation, it goes to it has the equity. It goes to each and every individual, irrespective of the age, their income, their socioeconomic status, and is beneficial for them.
Are the outcomes worse as we go further down the socioeconomic spectrum?
Yes, that is correct.
Across every age demographic?
Yes.
Okay. I'll ask, actually, Mr. Johnson. I'd like to ask you a question related to this. Excuse me, Dr. Johnson. Actually, Mr. Johnson, I'd like to ask you a question related to this. So, it's a very simple question, Doctor. I'll just ask you to offer the same analysis with respect to the jurisdictions that you're familiar with. Do we see a correlation between negative oral health outcomes that are worse along the socioeconomic spectrum? And as a sort of second part to that question, how big of an impact is fluoridated water, or how much does the fluoridated what's the optimally fluoridated water supply mitigate those impacts?
Well, we have very differing measurements. As a practitioner, we use dental x-rays. His measurements are made on a tooth looking in the mouth with a flashlight. They're looking for holes. So it's a public health study is very, very largely underestimating the amount of decay, disease that's out there. Mm-hmm. I will tell you that studies, not just in my practice, not anecdotal, but studies in New Zealand where fluoridation was begun just a couple of years back, and they looked at 2 cities that were not fluoridated and one that was. They fluoridated one of the 2 cities that were not. They watched it go up after 4 years. It was at the same level of cavity reduction, which is around 60 to 70%, and the cavity rates down in this unadjusted city were the same as they were. He would look at those people in those communities and not see the same increase or decrease in cavities because they're looking, actually, it's much worse. They look at a tooth, and if a tooth has a hole in it, it's counted as a tooth of 1. A more very specific measurement is the surfaces of a tooth. If a whole tooth was cavity was involved, a whole tooth, in DMFT, it's called decayed, missing, or filled teeth, it gets counted as 1. If that whole tooth was decayed down in a DMFS, decayed, missing, or filled surfaces, it gets a score of 4. So there is a huge difference in what public health reports and what you see, Dr. I keep calling him Dr. Charles, thank you. What we will tell you as dentists from what we see, not only as a hole in the tooth, but early calcification, decalcifications, white marks on the teeth of where the plaque is sitting. We see so many cavities beginning that we have to be aggressive when there's not water fluoridation in the area. We may have put a small filling in someone that had a cavity in a fluoridated area because we know that is not going to change much at all. Someone who comes from an area next door, next community over, that has that same small cavity, you put a small filling in it. 6 months later, that tooth has huge amounts of decay. You have to take it off, and as the pediatric dentist was saying, slap a stainless steel crown on the tooth to protect the rest of it. It's a major difference. Absolutely, it's the same across the world. And if I may make a comment about Child Smile, if that's appropriate, I know completely about Child Smile because I was in...
That's the Scottish program that...
Yes.
Okay.
Yes. Child Smile is, number one, it's only for children. It does not affect adults whatsoever. Number two, Child Smile costs about $135 per child per year. The British Dental Association recommended that if Scotland wanted to retain it, which they really don't want them to, they said start fluoridating your water as well. Now, I know this because I'm very involved with the British Fluoridation Society and the folks over there as well. We all work together around the world. But it does nothing to benefit the adults. And back to cavities on the root surfaces. Cavities on root surfaces, but one thing that really hasn't been said is fluoridated water works in 2 ways. One is it works systemically. It gets into the developing permanent teeth of children before the age of 8 while the teeth are still under the gums. So it makes them harder before those teeth erupt. Then it also, when you swallow fluoridated water, it gets into the saliva and it continues to come out onto your teeth, and it bathes your teeth 24 hours a day, 7 days a week. It's that increased amount of fluoride. It's a low amount, but it's that increased amount of fluoride that is the topical effect of fluoridated water that is given credit for giving the great reductions in cavities that we see in fluoridated communities. So without a doubt, and in the United States law, just quickly, it has been challenged many, many times in the U.S. courts. Anti-fluoridationists have gone to court. They're in now against the EPA because they didn't like what the EPA had to say to them. They have never won a court case in a court of last resort. Never. In every community in the U.S., this is a community-decided issue on fluoridation. Every community you're going to get sued. It doesn't happen. If they go up against a water utility provider, go ahead in court. The Fluoride Action Network's son is an attorney. Doesn't cost them anything. They lose.
Dr. Johnson, and I appreciate you offering all of that. I'm really trying to drill down on the socioeconomic issues and whether or not fluoridated water, optimally fluoridated water, is a significant contributor to good oral health for individuals who are in a more challenged socioeconomic position in communities.
100%. The disadvantaged suffer up to twice as many cavities as those that are not disadvantaged, and it benefits them greatly. It's not just the number of cavities, the sizes of them as well. So yes, the disadvantaged are benefiting from it more than others, but it doesn't matter your income level.
Sure.
It benefits adults, elderly, and children.
The reason I'm focused on this issue of the socioeconomic status is because in Canada, I assume in the United States, I'm less familiar with the healthcare system there, is the availability of services piece. And I know that folks at the lower end of the socioeconomic spectrum have less opportunities to get to have dental services or oral care provided to them. So, Dr. Ahmed, I'll ask you to comment on the availability of those services and the lack thereof, because I know there is a significant lack, and how important in that context for that particular population optimally fluoridated water supply would be for those people.
It would be huge, and we do have a provincial program that provides dental coverage through our health unit to very specific group of individuals, and it has a very strict qualification requirement. So they do get some of those services, but those services are very hard to get in the community. Their fee structure is reduced, and it benefits some portion, but there is a significant portion that do not even qualify for that, but they need dental services. And those are the individuals that would benefit hugely from it. And as a general, they all benefit because they all have these issues ongoing, and it's been causing them lots of problems as they grow older, and they continue to impact their ability to develop fully.
So unless we move to a system where oral health services are equally available to every single person in Canada or in the United States, we are not going to get to an optimally fluoridated water supply would be an excellent means to augment the oral health for people who are left out of the system currently.
Absolutely. I couldn't agree more. Thank you.
Councillor Sleeman.
Thank you, Your Worship. I have been listening to my colleagues. Actually, the advantage of it, if you stay kind of until the end, most of the question had been answered. But I still have some question, very simple question, and I need a kind of general answer on that. Dr. Ahmed, here in Ontario, isn't it true that I think children up to the age of 17, they get the oral health checkup and they get the fluoride treatment up to the age of 17? They get it from the health unit or for free, actually, isn't it?
There is a provincial program that has a very strict qualification requirement, and despite those increase in those, there is a huge increase in the need of those children, but that only covers very minimum dental care. There are other care that are not covered, and the fee structure is not supportive of that, and there are issues that are left unaddressed.
Mm-hmm.
I think one of the question was asked about chemicals in the water. And you said something about that the province or the Ministry of Health and Long-Term Care or Ministry of Environment, they monitor the water system we have here, whether it's in Windsor or in Ontario, actually. And they just monitor it to be sure it's clean and safe. Now, when it comes to fluoride, is it kind of mandated somehow, one way or the other, by the province to have a fluoride in the water?
So let me just correct you. The province and Health Canada sets the minimum acceptable concentration and the drinking water quality requirements. The water quality is actually monitored by the Utilities Commission that are distributing water to the municipalities, and they make sure that the water is safe when it's coming out of the tap. Going back to your question of mandating fluoride, as Dr. Johnson also mentioned, that this debate has been everywhere, and there are unique circumstances, unique situation to each of the individual communities, and that is why right now the decision is at the hand of the municipal councillors, and it would be great if there is any provincial or federally mandated fluoride program, but I ask myself, as a community, what are we doing for those individuals who need it? And is that the way that we should just defer the decision on this, on the province or to the country to make it legislated? We have a responsibility. You have the tool. You have the ability to make that decision. The science is very clear. It is impactful. It prevents tooth decays. There are no harmful impacts of community water fluoridation, and you can make the call.
Dr. Ahmed, at the very beginning, I think you were saying that we monitored the people in this community before the fluoride was introduced and after the fluoride was introduced. You're going back about 5 years ago or so on. And you find that definitely there was kind of more caries, more decay in the teeth and so on. What affect the decay and the caries? It's not just the fluoride, but also the diet, people, whether they're consuming more sugar and whether they are doing any of this stuff. So when you are doing the analysis, or did you ever ask that question, especially of the samples? Are you eating more chocolate? Are you consuming more candies? Whatever the case. Was it part of your studies?
So our oral health screening program looks into the mouth of every child, and that is what we are mandated by the province to do as part of our Ontario Public Health Standards. That assessment is focused on the visible appearance of the teeth, and it doesn't go into the details, because if we start doing that, that is much more resource intensive. We will have good quality of data, but it's not possible with the current resources that any of the communities have, any of the public health department, to ask those kind of questions in all the children that we are looking into their mouth.
I know my colleagues asked that question about if some people don't want fluoride in the water, but you mentioned the fact that for the good of the community as a whole, you have to introduce it, whether we like it or not. I'm sure you did a lot of research. Is any communities in the world, not necessarily in Canada and the U.S., actually, they have regular water with no fluoride in it, nice and clean water, but the fluoride it being added at each household. Maybe they have some kind of device where they can inject something to get the fluoride. To your knowledge, is any of such a thing exist actually?
I'm not aware of that. People can access whether fluoridated water or non-fluoridated water through different means. But when we're talking about the community benefit and who is impacted the most and what their wishes are, so I think that's where it goes back to the question, community water fluoridation benefits the majority and it benefits all. There is no harm associated with community water fluoridation.
So really here the question is whether fluoride would have any long-term effect on people. And of course some people say yes it does, and I heard like about pregnant women, but people talk about their IQ drop, but you said it's not substantiated, having been proven?
That is correct, yes.
Yeah. Okay, thank you, Doctor.
Questions of administration? Questions of administration? Councillor Ginia.
Thank you, Mr. Mayor. In regard to the options available to council this evening, can administration identify any issues of concern in regard to the options that are in front of us. And when I say that, they range from directing you to continue directing funds to the health unit, or on the other end of the spectrum, to direct the remaining funds to NWIN for the purpose of reintroducing fluoride to the water. So in that range of options that are available to council, are there any there that might cause you any concern?
Your Worship and members of council, if the desire is to move towards fluoridation, you will need to pass a bylaw in that regard.
And that's the only issue that we have to take into consideration?
We did have a discussion in camera about how that bylaw could be implemented, and we can certainly, if it is the will of council, we can certainly reconvene in that format to discuss it.
Thank you. I have a motion at the appropriate time.
Councillor Bordelon already beat you, Councillor Gignac. Of Administration, Councillor Costante.
Just very quickly, when was fluoride taken out? What year-ish?
5 years ago.
2013? Mm-hmm. Okay, thank you.
We've talked about different levels of fluoridation in the water. Can administration just confirm what level we plan to put in or we have put in, and to make sure that it's a process that can be very consistent, that we don't have to worry about that number fluctuating?
Gary Rossi, the Vice President of Water Operations from NWIN, is here from the Windsor Utilities Commission. Is it 0.7 parts per million, Gary? 0.7 parts per million.
Is there very much variation in that, Gary?
No, it's very well controlled through our
Okay, thank you very much.
Of Administration, Councillor Holt.
Yeah, thank you, Worship. I'm just hoping that legal can address the assertions that were made by Ms. Stomp about the risk to the councillors sitting around the table.
Certainly. Ms. Stomp is correct in that the Safe Drinking Water Act does indeed provide for criminal penalties and other with respect to an inability or inappropriate actions with respect to keeping drinking water safe. However, within that same section, Section 19, there is a due diligence defense. 19.5, a person shall not be considered to have failed to carry out a duty described in subsection 1 in any circumstance in which that person relies in good faith on a report of an engineer, lawyer, accountant, or other person whose professional qualifications lend credibility to the report. That would be with respect to the duties of those who are responsible for the drinking water. That is WUC. Those of you who have or will participate in the WUC governance model will undergo training by WUC respecting your duties under that legislation. There is also the provisions under Section 450 of the Municipal Act, which differentiate between policy and operational decisions, codifies the Kamloops and Nielsen, which brings in ANZ and London Merton Borough Council, and it has to do with the fact that when council acts in good faith, making a policy decision, which the addition of fluoride would be a policy decision, then they are immune from liability. You need to act honestly, competently, and with integrity as you move through these things. The manner in which fluoride's added, for example, if it's added negligently, that's an operational decision, and that's where that type of liability arises. Have I satisfied your request?
Absolutely. Thank you so much.
Other questions of administration? Direction, Councillor Bordelon, please.
I would move that in support of the Windsor-Essex County Health Unit's recommendation number 1, that we ask administration to prepare a bylaw to reinstate fluoride into the drinking water and to report back with next steps in that process. And I'll speak to it if I have a seconder.
It's moved and it's supported. Councillor Borland.
So this debate started 5 years ago, and that council of the day voted to remove the fluoride from the water, but also, in their wisdom, put in a return after 5 years, after looking at the state data and statistics, to revisit the issue. So here we are 5 years later doing just that. And I think what we've seen overwhelmingly tonight as a responsibility from us as councillors is a lot of data, a lot of support from organizations and the leaderships and the professionals that we employ to move towards reintroduction of the fluoride in our drinking water. I wish I could essentially take Joyce Zuck's presentation and reiterate it almost verbatim. I see why she's such a well-respected leader in the community and a previous great city councillor, because she hit upon a few things. So number one in 3 children in our community live in poverty. 1 in 3. So when we sat here and we asked Dr. Ahmed many, many questions as to why, could it be that they drink pop and eat chips and do these things? The reality is because they live in poverty. So that is one huge determining factor that we continually want to push aside. As people who develop public policy, we need to take that statistic extremely seriously. So matched with that statistic is 4 in 5 people in our community support this action. So it isn't something that we are going against something, people don't want it, and there are definitely issues that come across our desk. I mean, there's a lot of things that as public servants we vote on all the time. I hear it all the time from people who don't have kids. Why do they pay an education tax? It's for the greater good. It's to make sure that those 30% of children living in poverty don't continue to live in poverty, so that eventually one day we can get that down to 1%, 2%, 0. So, and then it's our responsibility as leaders around this table to trust in the leadership that we pay, support, and hire. If the chief of police was sitting here in front of us telling us, here are 10 things we can do to mitigate crime in our neighborhoods, in our downtown, we would listen to him because he's the chief of police. If the fire chief came here and said, this is what we need to do, we need to make sure that everybody has fire alarms in their apartments, we did that. And so we do the things, and we listen to our leadership. We have a direct medical officer of health. We need to listen to him. We've seen all the experts. We are not medical experts around this table, and out of the list of delegates, very few were medical or scientific experts, and the ones that were spoke highly in favor of reintroduction of fluoride. I don't think, I understand the passion behind not wanting it. I understand the arguments. There is a lot of information out there. Issues like this can get very convoluted, and at the end of the day, I'm not even going to step down and get into that foray when I have my medical officer of health that we employ, pay, and support telling us that we should be doing this, and at every question along the way said it was a good idea to do so. So for all those reasons, on top of the fact that, and again, this isn't one thing that is going to, 5 years from now, people will say, well, we introduced it and kids' oral health is still poor 5 years from now. This is one tool. Hopefully we can take this example and lead to making a lot of other decisions when we're talking about the policies and programs that impact some of the 30% of kids that do live in poverty in this community. So for all of those reasons, as one step and one tool in the toolbox to reintroduce, to hopefully get to a point where we can see, some increases in the good statistics when it comes to oral health, I'm supporting and tabling reintroducing the fluoride into our water supply.
Thank you, Mr. Mayor. When the initial debate in 2013 took place, I was one of the 3 councillors that voted against removing fluoride from our drinking water. And the debate that happened that night was as passionate or more passionate than it was this evening. We had experts from the Great Lakes Institute to address the issue of discharging fluoride into our Great Lakes. We had medical doctors. We had dental experts. But as Councillor Bordelin has indicated, here we are 5 years later with an opportunity to review the situation again. And I am most appreciative of the people who have stepped forward, the professionals in our community, Dr. Ahmed, who heads up our Board of Health, who the province indicates is the person that we should look to for issues that affect broad spectrum health issues in our community. A 51% increase in the quantity and severity of dental hygiene in our community over the last 5 years is more than alarming to me. A 51% increase. And when we're talking about this issue and we're focusing on children and children in poverty, I have to remind my colleagues that we're not just talking about children. A large number of people have approached me about elderly people who are experience significant problems at a time when these issues should not be rearing their head the way they are. I specifically asked two of our delegates if they considered reintroducing fluoride in our drinking water as an important tool, and they validated that. It's not the silver bullet. I recognize it. It is not going to eliminate dental problems, but it's going to go a heck of a long way. We've heard that proper brushing, of course, is a critical component, that we've heard that visiting your dentist, again, from a very early age is going to make sure that you experience good dental hygiene for a long time. But when you remove that one critical component, the fluoride in your water, you are removing a big portion of the tools that you have available to battle what I consider to be a massive health issue, because it's not just dental issues. When you have poor oral hygiene and when you're dealing with the volume of oral health issues that we're seeing in our community, it affects way more than just pain in your mouth. It's going to affect your heart. It's going to affect a number of other things in your body. So it's critical that we address it. And we address it in a way that's cost effective and it's equitable. It's equitable across our community. So I am definitely in support of the motion on the table, and I'm pleased to see us moving forward.
Motion to extend time, please. Moved and supported. All in favor? Opposed? That's carried. Councillor Holt.
Thank you, Your Worship. I've been rather quiet this evening, and I attribute that to the quality of the questions from my colleagues. Very thorough, and the amazing speakers that we had here tonight. It's a daunting thing to be asked as I'm a tool maker. I work with metal. I work in the automotive industry. It's very daunting to be asked to apply a blanket medication in the source water for every person in the city. But I'm also pride myself on my sense of community and how much I love my community and care for my community. And you know, it's not just the people in my immediate neighborhood, it's the people outside of my circle of friends, my socioeconomic circle. We have to take care of everybody in the community. And as an auto worker, I've got great dental coverage. I've got coverage here, and I take advantage of that. But there's so many people in the community that does not have that benefit. They might not, frankly, have the education to understand how important it is to have good oral care. It's as you've heard numerous times this evening, it affects everything from your self-confidence when you're looking for a job to other health effects that trickle down the scale. It's critically important, and I'm very happy to support the recommendation that's before us now. It's the findings in the reports and from the professionals that I rely on to come to this decision are shocking. And I know it's not attributable directly to the lack of fluoride. I know there's many other factors, but we have to do what we can, and this is something we can do as a municipality. And for those reasons that I'm supporting the motion going forward.
Councillor Francis.
Thank you, Your Worship. Just very quickly, I won't be supporting the motion. Great debate tonight. I'm sure it was a great debate 5 years ago. I'm sure it's going to be a great debate 5 years from now. But very simply for me, without a direct correlation, and we didn't hear, and everyone admitted today, there is no direct correlation with the situation we see now with removing fluoride 5 years ago. So without a direct correlation, I cannot vote to take away personal consent. I can't do it. I can't. So for that reason, Your Worship, I won't support the motion.
Councillor McKenzie.
Thank you, Your Worship. A lot of great comments this evening from all sides of this debate. Again, I won't reiterate my soliloquy from a few minutes ago. I'll just make mention of the fact that for me, this is a social justice issue. This is an equity issue, and in the foreseeable future, I don't see a significant improvement with respect to public access to oral care services for the people that will need them the most. This is something that we can do in our community by refluoridating our water supply, so I will be supporting the motion. Again, I think it's a social justice issue that is a measure we can take immediately or with some degree of expediency to address a clearly significant need in our community, as the report outlines. I'll leave it there.
Councillor Kaschak.
You know, as a new councillor, I realize we're expected to show good judgment on topics that we're not experts on. And as well, we have to make judgments, from time to time based on conflicting evidence. So based on this, I'm going to side with the medical experts and support the motion. Thank you.
Councillor Morrison.
I'm looking at this vote tonight, and I look at a few things. First thing is my own life experiences. I grew up in a small town with no fluoridation, and I saw the impact of that growing up, and I compared that to my children who were in a city that did have fluoridation, and I saw the stark differences. So that certainly influences my decision making. But I'm also listening to the opinions of the public, and I really appreciate everybody that talked tonight. I know you're sincere and engaged and want to do the right thing. The third area, though, is the expertise of the professionals in the field, and that is certainly outweighing the other factors by a considerable amount, because we've all said that we're not experts in this field. I listened to 5 professionals in the field tonight. All 5 of them enthusiastically endorsed putting fluoridation back into the water, and I have to really take heed to that. We have to do what's best for the community. 4 out of 5 people is a significant majority in terms of people that support this. And it's not just a group of people that say, I don't want this, versus a group of people that say, I don't have a problem with it. I'm getting calls and feedback that people want it. So it goes both ways, that there is a significant amount of people out there. They may be the silent majority, and they are, but they want it. They want it for the betterment of their children. So I definitely look at that seriously as well. there are a lot of new immigrants into the city. There are a lot of people in the spectrum of income and education that we can certainly help, and it's significant. And we talk about the poverty levels in Windsor, so I know it's not all about the children, but a big part of it is, because that sets the tone for the rest of their lives. So I'm not afraid of any lawsuit here. I know I'm making a very diligent decision based on expert testimony. There's nothing inappropriate we're doing here, so I will very much support the motion on the floor. Thank you.
Thank you, Your Worship. I just want to start off by acknowledging everyone who's spoke as a delegate. I can tell you I've read every single email up until about 5 o'clock today. And there's been a lot of energy, a lot of work put into this. There's some findings of fact that I've got to express. Number one, the decay rates we know have increased 51% since we've taken fluoride out. We've learned that lack of fluoride is a contributing factor, and that it's one piece of this puzzle. There's a correlation of poor oral health and income levels, and I find that to be morally unacceptable. And I agree with Councillor McKenzie's point that this is, to a large degree, a social justice issue. We talk about 1 in 3 children growing up in our community in poverty. Well, guess what? There's some communities where those numbers are even worse. United Way report suggests in some communities those numbers are even higher. And so this is, to a large degree, a social justice issue. And we also learned that fluoride consumption at its worst, and this is a finding, leads to fluorosis, which, to my understanding, what we've learned this evening, it's white spots on your teeth that have no adverse mental or physical effects. So on all those reasons, I have to support, I'll be gladly supporting the motion.
On the motion, Councillor Kuzmarchuk.
Thank you, Your Worship. And again, I want to thank everybody here for what was an excellent and enlightening debate. And I'd like to thank the Health Unit for bringing this important issue to light in the community. The problem of tooth decay and poor dental health is real in our community of Windsor, Essex. And I thank, again, the Health Unit and the delegates from the medical community for raising this important issue and bringing compelling evidence to the forefront. More children are having more problems with their oral health in our community, and the decline among our young people is growing faster than in other parts of Ontario. That decline in oral health started and accelerated before the removal of fluoride from our water system. And that fact indicates to me that there is something bigger than citywide water fluoridation that is driving this problem. We know diet matters. We know that it matters very much. And we know that sugar is a major culprit. We know that that is the major driver. And we know that compared to children in the past, say 20, 30, 40, 50 years ago, the children of today are dealing with sugar, with this culprit, in all of their foods at greater amounts than ever before. Whether it's fruit juices, whether it's milk, whether it's yogurt, you name it. That's the big culprit. We also know that good oral hygiene, like brushing your teeth, matters as well. And we know that access to dentists and regular visits absolutely matter. And not enough of our young people, our children, are going to dentists before their first birthday. That's absolutely critical. And I think that that's where our focus should be. The evidence that water fluoridation reduces tooth decay is strong, and I acknowledge that. But it is not without valid questions, and it is not without challenges, and it is not a silver bullet. It does not address the underlying drivers of this very real public health problem. The evidence from programs such as Child Smile in Scotland demonstrate that the incidence of tooth decay can be reversed dramatically in a community if stakeholders, that's all of us in this room, come together and offer programs that target those specific negative drivers. And that means intervening in daycares and elementary schools in vulnerable communities to provide the basics of oral health. That means giving out toothbrushes, toothpaste, as well as access to professional dental care, dental visits, varnish applications. And it also includes behavioral coaching, supervised brushing for children, and finally access to healthy food options. All of those make a difference. Those are the solutions to these problems. And so if we're going to step up and address the significant oral health challenge in our region, all of us need to get beyond the debates that divide us. And we need to come together. We need to understand each stakeholder's role and recognize each stakeholder's strength in this battle. And primarily, I do look to the province of Ontario, the Ministry of Health, for leadership on this issue, and that is leadership that is absolutely sorely lacking on the issue of dental health. They have the expertise, they have the funding, they understand the trends, and they should rule, and they should improve their leadership on the issue of dental health. Having said that, I was ready to, I came in here leaning towards not supporting water fluoridation. Again, because of the issues that I brought forward, because I think the focus ought to be on the real drivers of these challenges. But having said that, the numbers are compelling to me. And I think rather than waiting for the province of Ontario to act, rather than waiting for the province of Ontario to pick up the mantle and do something in our community, I think we have an opportunity to do something that the experts here tell us makes a difference. Doesn't solve the issue, but they say that it does make a difference. And for that reason, I will support this motion.
On the motion, recorded vote has been requested, please.
Your Worship, members of council, the motion on the floor, moved by Councillor Bordelin, seconded by Councillor Gignac, is that the recommendations of the Windsor-Essex County Health Unit be supported, and that administration be asked to prepare a bylaw to reintroduce fluoride to the drinking water and to provide a report back regarding next steps to implement the same. On the motion, Councillor Costante.
Support.
Councillor Gignac.
Support.
Councillor Morrison.
Support.
Councillor McKenzie.
Support.
Councillor Holt.
Support.
Councillor Kuzmarchuk.
Support.
Councillor Sleeman. Councillor Francis.
Opposed.
Councillor Kashak.
Support.
Councillor Bordelin.
Support.
Mayor Dilkins.
Opposed.
That motion carries.
Members of council, that concludes the regular business items. Consideration of committee reports have been moved by councillors Bordelin and Costante. All in favor? Opposed?